I was sitting in a C course with Dr. Michael DeTola, and he said in front of the group, dentists are the only profession that, as he may have phrased it, dumb enough to work on our patients while they're awake. Every other profession that does these micro things puts people to sleep. And I am here talking with the awesome Dr. Michael Silverman of Docs Education, Nachos sponsor, about how they help dentists learn IV and oral sedation. Welcome to Talking Nachos, Dr. Michael. Share with us a little bit about your company and what you help dentists do to be more successful.
Well, thanks for having me, Paul. Docs Education has been around since 1999. We've had the privilege and opportunity to train nearly 30,000 dentists on how to provide safe and effective sedation for their patients. Now, they're not asleep, just be clear about that, but they are sedated, and all sorts of different terminologies are used by different regulatory bodies. But what it does is it gives us the opportunity to attract to our offices within our community the nearly 30% of the population that are avoiding dental care due to fear. Right. And for those who aren't avoiding it due to fear, but are avoiding it due to multiple visits, 10 visits to get a restorative process completed, most of the time with sedation, that can be done in 1, 2, or at the most 3 appointments and is done, and then their busy schedules are not interrupted.
Love that. I mean, so you're sharing that there's a segment of our population that would not get dental care done. We wouldn't be able to help them chew and smile with confidence without this. Walk us through in the most basic way. How does the dentist start on this journey? Maybe just share with us why someone would learn oral sedation and then IV sedation, both at the same time. Our audience would love to learn.
Yeah, well, I think it would begin, depending on the doctor. Some dentists, because of the population they do currently see, don't believe that there's fear out there, because the patients who are coming to their office aren't necessarily afraid. Once in a while, they get that patient they call the scaredy cat, and they use a calm voice and they relax them and they're able to get them through. But there's a huge percentage that just aren't coming into you because literally their palms are sweating, they're breathing heavy, they're hyperventilating, and they just can't even get into the front door. So I think the first part is the recognition that, one, there is a population within their community that really needs to be served that are not being served, because we do have statistics clearly that says that this percentage of fear is not going away.
I can totally see that. I mean, it's patients ask us this all the time. We actually have a GP that focuses on oral surgery, who uses oral sedation, and it's a big unlock to getting patients to move forward. As a dentist who doesn't do any sedation currently, where would people start in their journey with docs? Do they start with an oral sedation course?
Most of people will start with the oral sedation, because the idea of giving a pill or a series of pills, incremental oral administration technology, is something within their abilities, within their, it actually makes dentistry easier when they do that. There's not a lot of extra armamentarium involved. There is the need to be able to measure oxygen and pulse and blood pressure and carbon dioxide on the patient to keep the situation safe. But other than that, there's very little additional to what they need to do, with the exception of making sure that it's organized correctly.
Love that. I'm bringing up your website here. So in this oral sedation journey, and I like to help dentists love details, you guys have, my grandmother always said I was very special, Michael. I think she was right. So dentists and nachos are special because they can save, their favorite thing to do. I've noticed dentists love, more than they love the Krebs cycle, saving money, Michael. So we have the oral sedation course, and people can get a discount. They can text sedation to 215-543-6454. But walk me through what I'm seeing here with the next oral sedation course.
So this is the adult oral sedation course. We provide these through an interactive live streaming program where you don't have to leave home to attend the program.
Nice.
The program basically is about a 24-hour, 25-hour program. The first third you do online with some quizzes, followed by a two-way video feed with our faculty, where you review the information and the quiz questions. And then there's 2 days, a Friday and a Saturday, where you'll be attending, where our faculty will live stream from a studio the lectures, where you can ask questions and things like that to get the full curriculum. It also comes with a very extensive manual of over 200 pages so that they can follow along literally slide by slide. They're not pictures of slides, they're actually paragraphs that describe it so you can go back and read it later. And we do these 3 times a year, this particular program 3 times a year. And it's the best starting point for the majority of dentists, unless, Paul, they're in states like Pennsylvania.
Oh, geez. Tell me about my state. What happens there?
Where the regulatory environment is very strict. And yes, you can give nitrous oxide. Yes, you can give 1-pill sedation, which isn't super effective. Or you've got to jump all the way to IV sedation to be able to incrementally use oral sedation even. So we have a lot of doctors who might come to the oral program, realize that they're limited by their regulatory situation and decide to go forward and get their IV permit, which gives them the ability to do both IV and oral sedation safely and effectively.
Awesome. Well, now we'll jump over the IV portion. You have a course coming up in September, not too far away. People can use a discount code through Dental Nachos to save on both of these courses. Just text sedation to 215-543-6454. My team can also share that in the comments. Now walk us through the IV sedation training.
So the IV sedation training is very, very unique. So the biggest problem with IV sedation in general in the training process is the amount of time necessary away from your practice or away from your family. So by using the latest technology of 2-way Zooming, interactive live streaming, and online programs, you're able to do the majority of the didactic portion of the program before attending only a 4-day clinic session. So there's only one travel, 4 days of a clinic session where you do emergency medicine training, and then you physically treat and sedate 20 patients with our faculty at your side so you can learn how to do it. The biggest thing to learn, because dentistry is easy for the majority of people, the biggest thing to learn is how to get IV access. So we have an enormous amount of training on how to get IV access to be able to provide these IV drugs safely.
Awesome. I mean, oh, keep going. Sorry, I didn't mean to cut you off.
I was just going to say, and another little benefit, or not, I don't call it a little benefit, I consider it a big benefit, is that we are providing these services to patients at no charge, and it goes to a specific type of community within Lexington, Kentucky, and Salt Lake City, where these patients really need dentistry to be done. Now, you're not doing bridges and you're not doing implants. You're doing just simple, straightforward, urgent care, extractions, fillings, a cleaning which they haven't had in many years. So it's a wonderful feeling. We've probably given away $6 to $8 million worth of dentistry while we've been doing these programs. So it's a nice addition to what we already are providing.
I like it. Doing good while doing good. That's awesome.
Yeah.
Now, as we kind of wrap up a little bit, I know dentists like to talk about details, right? They talk about how they do it and learning, but how about the transformation of the dentist and training all these people? Dentists don't always jump into things quickly. They might be reserved. I'm not sure if I should do this or not, but maybe think of someone who you've helped who's now, their practice is different. The way they treat patients is different. And they say, I'm so glad that I took this leap. I'm so glad I responsibly learned how to do this. Tell us about some dentist transformations.
Well, over the 23 years, there's probably thousands and thousands of stories like that. In the oral sedation training program, we try to motivate the doctor to include their team in the training, which helps the doctor implement rather than sticking that book up on a shelf and waiting whenever they feel like it. And in the IV world, they have to bring a dental assistant to the clinic. So they're forced to implement when they get home, which is really important because like you come home, you're all excited, and nobody else is as excited as you are.
Yes, that is called the Monday-itis annoy your team problem, right? I went
exactly
without
I'm
you.
so excited about this, and they're like,
and they say, oh, geez, what's going to be in the closet next? So
right,
I love that, and I just think my perception is you're dealing with patients who have a fear factor. And the more the team is confident, the better it is for everybody, right? So I know it's from
that's the story. Exactly.
yeah, safe. I know it's from totally a safety perspective, but also just in how they communicate that, oh yeah, patients have this done here, and we're able to make you less aware of what's going on in your mouth. Like, maybe fully asleep is not the right way to put it, but less aware. And, I had my wisdom teeth out, and I had IV sedation for my wisdom teeth. So as a human being, I remember that time. So I think you guys are doing just an awesome thing for dentists as they get more into surgery. I mean, there's just more surgical procedures being done, from implant placement, sinus lifts, periodontal procedures. And I think one of the things you hit on to start was some of this work takes a long time to complete if people are fully aware of what's going on. So if you can utilize sedation to make the experience more comfortable, I think that's awesome. So we're proud to have you as a sponsor. Is there anything else you'd like to share with our community about Docs Education as we kick off your Nachos sponsorship here?
Well, just the two things. One, you mentioned when you had your wisdom teeth, you had IV sedation and you remember the experience, but the truth is you don't remember.
I remember I was glad to have it. So I forgot.
I'm glad to have it. And that's what sedation is really about. It's about the amnesia more than it is about the depth of sedation, because they don't remember it. They're comfortable. They want to come back. I think the one thing I would like to share with the community is how it changes the lives of the patients. Yeah. And when you ask for stories and success stories, the ones that come to my mind are the success stories of the patients whose entire lives were normal with the exception of the fear of their mouth. And they wouldn't smile. They would always talk like this because they didn't want anybody to see how bad their teeth were, right? And everybody thought they just were mad people.
Yeah.
And then we restore their mouth while they're sedated, and all of a sudden their whole personality lights up. Their job opportunities increase, their family and the relationships are better. And you know what? That's really why we do dentistry in the long run.
Yeah, I totally agree. So yeah, it's truly to help not only us, but our patients truly smile more. And I think that's a great way to put it. Well, people can text sedation to 215-543-6454 to get the best deal possible from our awesome sponsor, or reach out to us at dentalnachos.com. Thanks so much for sharing it with us, Dr. Mike.
My pleasure.